Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. Thank you so much for joining me again today. For those of you who enjoy listening to the Rational Wellness Podcast, please give us a ratings and review on Apple Podcasts. And if you'd like to see a video version of this interview, you can go to my YouTube page. And if you go to my drweitz.com website, you can see detailed show notes and a complete transcript. Today, I'll be speaking with one of the nation's top integrative experts on cancer to get her perspective on the current coronavirus pandemic, including how it impacts cancer patients. Dr. Nalini Chilkov is a doctor of Oriental medicine and an acupuncturist with more than 30 years in private practice in Santa Monica, California. She's lectured at both UCLA and UC Irvine medical schools, as well as at schools of naturopathic and Oriental medicine. Dr. Chilkov is recognized as one of the go-to experts in integrative cancer care and immune enhancement, and she runs the American Institute of Integrative Oncology. She offers an incredible Foundations of Integrative Oncology online course for clinicians to learn how to help manage the health of cancer patients while they are undergoing traditional care. Dr. Chilkov, thank you so much for joining me today.
Thank you for having me.
So I know you have a little bit different perspective on this COVID-19 coronavirus pandemic, but before we get to that, since we're in Los Angeles and we're all on lockdown and stay-at-home orders, how are you managing to still see some patients, or how are you handling this situation?
Well, my practice is composed of patients from all over the world. And so I've been doing telemedicine for a long time. And so I'm just doing it from home right now.
Oh, okay. You just don't get to see the in-person acupuncture patient.
Yeah. So the people who come to see me in Los Angeles are also consultation and cancer management patients, but many of them come in for acupuncture. So that's the piece that isn't happening. And those patients have a bit of resistance to doing a telemedicine visit because they're accustomed to seeing me in person. But right. I'm just carrying on here.
We're all carrying on.
Right.
You can see I have the mark of the mask from wearing an N95 mask all day.
Right.
It sort of tends to rub the skin off across your nose. So tell me about your latest understanding of the coronavirus and what's going on with this situation.
Well, I've invested a considerable amount of time trying to understand this, looking through a slightly different lens, because there's plenty of brilliant people who are teaching us about the physiology of this virus and sort of the standard nutraceutical approach. But I think we really need to think about the arc of this experience that patients have, and how we address patients at different phases of that journey. But also, because of my interest in Chinese medicine and Chinese herbal medicine, I have been taking a deep dive into what has been going on in China. And over 90% of COVID-19 patients have received Chinese herbal medicine concurrently with Western herbal medicine. And this has not very publicized. And also, there's a couple of studies, they're now publishing what they've been doing with these patients. And there's some emerging patterns of what makes sense and what's working. So I like to share that. But I also want to share that there were 2 studies that came out of China demonstrating that the caregivers, the frontline, up close and personal caregivers in 2 hospital settings, were given Chinese herbs to keep them from getting the infection. And there was a set of clinicians in 2 different hospitals that did not get sick in the midst of treating these patients. So I think we need to be thinking about how to care for the caregivers as well, because we have higher exposure being intimately involved with our patients.
That's a good point. And simply giving them masks and protective equipment is really not enough. Yeah,
it's not sufficient. Masks don't protect you 100%. And I think we also need to think about who are our more vulnerable patients. Now, the demographic of the patient population in China is different than in the United States. So we're actually seeing different trends here. So although in China, the elders and the men were more vulnerable, our population is different. In China, most men smoke and most women don't. So that's puts a disparity in lung vulnerability in that population. What we're seeing in the United States is that it's not so dramatic in terms of age. Once you get over 80, you're highly more vulnerable in the United States. And certainly between 60 and 80 is slightly more vulnerable. But we have a significant number of patients who are between 30 and 50 who are being hospitalized here as well. We also have more obesity.
Do you think that's because we do such a good job with getting chronic diseases that we don't wait till we're older to get them? We end up with diabetes and heart disease.
Yeah, that's the problem. We have obesity. Yeah, we have an epidemic of obesity and metabolic syndrome and diabetes that is driving high risk in all age groups. It turns out in the United States, the worst outcomes are in obese patients. If you take the age factor out,
not a shock.
Right, because of the high inflammation. If you have diabetics of any age, these people already have more inflammation, more oxidative stress, and more kidney damage. And so we know that one of the vulnerable organs in this syndrome are the kidneys. So if you lose kidney function, we also have, so the complications of this disease are lung fibrosis, myocardial damage, kidney nephron fibrosis, disruption of the gastroenterologic tract because we know the virus is found in the gut. And in fact, David Brady, his company Diagnostic Solutions, is developing a stool test to look at the virus in the stool.
It's already available.
Right. And so we have this bigger picture to consider, and there's a subpopulation of people who contract this who develop this cytokine storm, this hyper upregulation of the immune system. So patients who have autoimmune disease are more vulnerable, but also we have a lot of cancer patients who've had immunotherapies who have ratcheted up their inflammatory cytokine titers and who now have autoimmune disease on top of having cancer. And these are highly vulnerable patients. We have cancer patients who are myelosuppressed due to their chemotherapy treatments. And we have cancer patients who have leukemias who already have elevated levels of white cells. So we need to think a little bit differently about patients in terms of age demographics and risk factors in the United States versus what the information we've gotten out of China. We're a different population here.
It's still fairly predominant in men over women though, right?
It is. It's interesting. And, women do have different immune patterns that thought evolutionarily in order to carry a baby that has different DNA than you have, to be able to do that, your immune system has to be able to adjust, right?
Right. And isn't it the case that estrogen it leads to a stronger immune system, and that during pregnancy, the estrogen drops so the mother doesn't react, and that's why women have a higher risk of autoimmune disease?
Yes. So we want to look at where a woman who's diagnosed with the disease is in her hormonal life cycle, right. And if she's on hormone replacement therapy, and if she gets sick, do we want to withdraw some of her estrogen so that she doesn't have a cytokine storm? I mean, these are questions.
Or maybe the estrogen is immunoprotective.
It might be, but the real risk that we're learning is not from the virus itself, but how it hijacks the immune system. And in those patients whose immune system goes into overdrive, that's where the damage and the mortality is being seen. And these are the patients that get the most into trouble breathing. These are the patients who, if they don't die from the syndrome, they come out of it with a high level of lung fibrosis, possibly myocardial damage. Most of these patients have nephron damage too. And so we're looking at a population of survivors that need our help. They need functional medicine. They need what we do because we know how to repair people and restore function. And I think we need to really be thinking about all this fibrosis that this disease causes as well. So we can have a big impact on the prevention, and we can have an impact with the survivors. And if we have patients who are staying at home with this illness, then we have a lot of antivirals and botanicals.
And is the fibrosis mainly in the lungs, or is it in the other organs as well?
Well, the fibrosis is being seen in the lungs and the nephron, and the nature of the damage is to the myocardium. It's not expressly fibrotic, but wherever tissue dies, it gets, more fibrotic. So
as soon as I think of fibrosis, I immediately think of modified citrus pectin and galectin-3 and, Isaac and...
Yes, I think we need to think about that. Where I actually think about is Chinese herbs have a lot of research on their impact on fibrosis. And one of the herbs I use the most in cancer patients for fibrosis, which is very common in cancer patients, is Chinese red sage, Danshen, Salvia miltiorhiza. There are studies on that and lung fibrosis. I've seen studies on white peony by Xiao Paeonia alba and fibrosis. So there's a number of botanicals which do have research on their impact on fibrosis. And these are botanicals that change the amount of development of fibrotic tissue, the activity of the fibroblasts.
So these could be taken ahead of time to reduce the potential for fibrosis, or would they?
No. I think of using them
after
in the recovery period. But if you have a patient who you can see is in a physiologic state where fibrosis is going to happen, I would think about using them then. Remember, the fibrosis is the sequela of extraordinarily high amounts of inflammation and oxidative stress. So those patients also need to take N-acetylcysteine, because that, of course, is producing glutathione and quenching a large amount of the oxidative stress. But, remember that N-acetylcysteine is also used in medicine to thin secretions in the respiratory tract, and it can actually be nebulized. And so we can think about putting people on nebulized,
Yeah, they're using IV vitamin C, and that seems to be having some effect. And so that may be one of the ways that vitamin C plays a role as well.
IV vitamin C is being used in China in hospitals, and we could certainly use that here.
It is being used in some of the hospitals in New York.
Oh, is it? Oh, yes. That's fabulous. So I think that is intervening with the cytokine storm. I think that's what that's doing. And quercetin also acts in that way. A lot of the formulas in China have the herbs that are in them have high amounts of quercetin and high amounts of resveratrol and high amounts of berberine. So if you just look at the phytochemicals that are in a lot of the formulas that are the dominant formulas being used, that's one thing I'm seeing. And then the Chinese Materia Medica has a large number of antivirals, a very large number. Another herb that you see in a lot of the formulas coming out of China is Scutellaria bicalensis, which is used widely in cancer treatment. But Scutellaria bicalensis has phytophenols in it, bicalin and bicalene, which are active in the viral replication, but also they're in the category of bioflavonoids. And so like quercetin, they actually change the conformation of the virus at the cell membrane and its ability to bind and enter into the cell and start taking over the machinery of the cell. We also, David Brady and Peter D'Adamo talked recently about nettles. Now, there's some confusion. I've had people ask me, nettle leaf and nettle root are two different medicinals.
Yeah, they were talking about nettle root, which I use on some of the male patients who have high levels of binding protein, the whatever it is, the one that binds testosterone.
Yeah, it's an aromatase inhibitor, basically.
Yeah.
Now, so nettle root is used also in estrogen dominant cancers where there's estrogen receptor positive. And you could do that in testosterone receptor positive syndromes also, to deal with the aromatase enzyme transforms androgens into estrogens in the tissue.
Right.
And so that's helpful. But nettle leaf is also used as an antihistamine. And so some people, I think, are confused about which is being used in COVID. I think that clarification needs to be made.
Right. So it's the nettle root that you want to use for COVID, right?
Yes. Yeah, because we're not having high histamine. We're having high cytokines.
Right. Okay.
And we have this virus that specifically binds. So there is a very, very brilliant Chinese doctor named Michael McCulloch who practices in the Pine Street Clinic up in San Anselmo in Northern California. He's a long-term friend and colleague of mine. And he is a PhD epidemiologist as well as a doctor of Chinese medicine, and he speaks Chinese. And he's been tracking all this research. And what he did is he took all the herbs that are currently being used in China, and he looked at which ones can we get in the United States, and then he looked at which ones are actually active with this virus. And he made a list of those, because a short list of things we can get here. And so I looked at that list, and there is a Chinese herb company that I like very much called Health Concerns that has some formulas that already exist that I think we can use. In my clinic, I do compound custom formulas, so I can replicate the formulas that are used in China. But just for the clinician who isn't doing that, Health Concerns has a formula called Clear Heat, which has most of the antiviral herbs in it that are being used in China, not all of them, but most of them. There's also a formula that's called Enhance, which was developed by Dr. Misha Cohen during the AIDS epidemic in San Francisco in the early days. And it's a combination of Chinese medicinal mushrooms, antivirals, and also tonic herbs. And what was found in China is that these patients need to have digestive tonics given to them. The patients who have digestive tonics given to them, and I'm using probiotics as well, do better. Isn't that interesting?
Yeah,
so
apparently
their nutritional status is maintained, right?
Yeah, a significant percentage of patients who are hospitalized have GI symptoms.
Yes. So there are traditional Chinese herbal formulas that support what we call digestive qi. And so that's in this enhanced formula. So that's a really nice formula, I think, for recovery also. And it could be used for the person who just also doesn't want to get sick with this. It's a nice formula for that. Whereas the Clear Heat is for if you have a viral infection. And so those are two formulas that are available. There's a traditional Chinese formula called lily bulb formula that is available from Health Concerns, and it's available from a lot of companies that make Chinese herb granules and things. That is for the lung yin. That's for the patient whose lungs have been burned by inflammation, and that would be a really nice formula for people for recovery, right?
What about some of the Western herbs you hear a lot of people talk about, like andrographis echinacea, elderberry?
So andrographis is actually an herb traditionally used in Ayurveda and China. It's actually of Asian origin. And it has a lot of studies on it. Metagenics makes a formula called Andrographis Plus, which could absolutely be used. You could combine that with the Metagenics formula Immucore. You could put those two together. That's a nice combination. With that has Chinese mushrooms and the A and the C in it. You can add some vitamin D and zinc. If someone wants to just put together a basic protocol, vitamin A, vitamin C, vitamin D, zinc, some probiotics, and some kind of Chinese mushroom product, clinical synergy, Isaac's formula, Isaac Elias formula. I like their Mycoceutics Immune Max is a very nice formula. For these patients who are super inflamed, as you mentioned, the Pectosol C could also be used. I think that's a thought.
Yeah, there seems to be a fair amount of research showing it reduces fibrosis. So
yes, it does. It absolutely does. When there's traditional old-time naturopathic medicine where you do hot castor oil packs, hot castor oil fomentations over fibrotic areas, it does not penetrate all that deeply. So I don't think it's going to get into the lungs or into the kidneys, however. So you can use it over the pelvis, certainly, but that's not where we're seeing fibrosis in these patients. So.
It seems to be some data that heat is beneficial in helping to reduce the ability of the virus to grow and to flourish.
Well, that's in a petri dish, so I don't think we really know what. I just read a comment yesterday. There's some people are hoping that this is going to behave like the influenza virus and decrease in the summer, but there's evidence that that is not a factor, that this virus is very happy in warm weather also. So certainly in terms of our food safety, if we're concerned about that, the virus is killed by cooking. You have to get your food heated. So people are particularly vulnerable and immunosuppressed. They might want to not eat raw food right now and cook all their food if they're really, really concerned. That's something any immunosuppressed person might think about, not having more exposure to bacterial pathogens in food and the lipopolysaccharide immune triggers, inflammatory triggers that come with that. So it just kind of depends where someone is on the spectrum, and that's why patients also need us, because we really treat so individually,
I've really been enjoying this discussion, but now I'd like to pause to tell you about the sponsor for this episode of the Rational Wellness Podcast. This episode is sponsored by Pure Encapsulations, which is one of the few lines of professional nutritional supplements that I use in my office. Pure Encapsulations manufactures a complete line of hypoallergenic, research-based dietary supplements. Pure products are meticulously formulated using pure, scientifically tested and validated ingredients. They are free from magnesium stearate, gluten, GMOs, hydrogenated fats, artificial colors, sweeteners, and preservatives. Among other things, one of the great things about Pure Encapsulations is not just the quality products, but the fact that they often provide a range of different dosages and sizes, which makes it easy to find the right product for the right patient, especially since we do a lot of testing and we figure out exactly what the patients need. So, for example, with DHEA, they offer 5, 10, and 25 milligram dosages in both 60 and 180 capsules per bottle size, which is extremely convenient. And now, back to our discussion. Well, are there any natural products that work similar to the way hydroxyquinine works, which has been talked about as one of the preventative drugs that may have some benefit?
Well, I think this is all conjecture. Is all conjecture. Not to my knowledge. I mean, you can use quinine, but
Yeah, people have talked about
the
Artemisia.
The problem with hydroxyquinone is that it should be assessed patient by patient because it does have cardiac toxicity. It also seems that you have to give it with zinc to get a really good effect because of the entry into the cell. So I think we just don't know enough, and I think it's really dangerous to be having intellectual exercises around this until we have more data because these patients are vulnerable. And so we certainly don't want to experiment on them. But for our relatively well
Donald
population,
Trump says it's the game changer.
Donald Trump knows nothing about science. So, I am fairly conservative and was a cell biologist. And I think that we have to go with data. I think that this particular virus is an animal we don't understand completely. And of course, will be mutating and changing. And that we just need to go with what we know will be of benefit to our patients for sure, right? So what changes the cell membrane? What changes inflammation? What changes immune response? What changes epithelial barriers? These things, we know what to do, right? And so again, then you can go back. Vitamin C, vitamin A, vitamin D, zinc, probiotics, and then some immune enhancement. So if you want to think the immune enhancement part, I like the high quality Chinese mushrooms plus astragalus, which is a great immune tonic and a lung tonic. But a caveat here is, as soon as a person is diagnosed with it, so those go in the prevention box. As soon as a person is diagnosed with, or obviously has the viral exposure and infection, I withhold those because we don't know which patients are going to have cytokine storms. And patients who continue to use astragalus and Chinese mushrooms will have exaggerated cytokine storms. This is the elderberry question as well. Now, elderberry is very mild, so I'm not so worried about it if people use it, but echinacea falls into that category as well. That can increase and make worse a cytokine storm. So I always like to err on the side of safety. So I pull out those things which potentially will make the inflammatory response bigger. I take those out and then put in the antivirals in a much more aggressive way. So andrographis falls into that category. Another category is isatis, is another Chinese herb, which is a potent antiviral. The very well-known yin chow formula used for colds and flus has honeysuckle in it, and that has been shown to be active against this virus. And that's lonicera. You'll see that in many formulas. A chrysanthemum has been shown to have some activity. I think about an herb like feverfew, which Tanacetum parthenium, which is super anti-inflammatory. And so I think about putting that into these formulas. Think about other herbs that we know act on inflammation in the lungs, like boswellia, right? Boswellia is very powerful for inflammation in the lungs. It not only interacts with the COX enzymes, but with the LOX5 enzyme, which is more active in the lungs and in asthmatics, for example. And so I'm using that. The boswellia is also active in the gut. And so I'm thinking about using lots of omega-3 fatty acids in these patients to make the cell membrane healthier and to dial down inflammation. And these are very safe things, right, that don't have a lot of drug interactions. Also, we know that the over-the-counter NSAIDs, the non-steroidal anti-inflammatory drugs, seem to make this worse. And so although people are having inflammation and might want to reach for those, it's been advised that people not take Advil and Aleve or even aspirin when they have this syndrome. So I think, again, we're just all really learning. And we have to also learn on our American patient population, which is, the average patients taking 10 to 20 pharmaceuticals at the time they're diagnosed also. So
What about when the patients, if they're sick and they start having breathing problems? Is there anything you think about using then?
I think that anyone who is showing respiratory distress of any kind should be seen by a physician and be evaluated for oxygen. These people basically are having airway constriction due to inflammation. So think of what an asthmatic lung, what happens to an asthmatic lung, that the airway is obstructed due to an inflammatory response. In this case, it's not eosinophils, it's inflammatory cytokines like IL-6 and IL-8 and IL-1B1. So we do know we have lots of botanicals that interact with those. Those happen to be the cytokines most ramped up in cancer as well. So curcumin is available. And the other thing that's happening with these patients, this extra inflammation leads to hypercoagulation. And so some of these patients are forming a lot of thrombi. And so if you have a patient that's having pain in their lower legs or suddenly gets short of breath, they may have developed a dangerous thrombus. So these are medical emergencies, and we should not be messing around. We should be getting them to urgent care, basically.
Sure.
And but what we can think about, do you have a patient who has a higher risk of thrombus formation, right? Like a diabetic or an obese patient, a hypertensive patient, right? Their blood vessels are too constricted. So these patients should stay hydrated also. Even a low-grade fever can disrupt your electrolytes. So making sure patients are not only replacing fluids, but electrolytes. And I've seen people become both sodium and potassium depleted going through this syndrome. So very important. And then how do we repair tissue and hold on to fluids and make antibodies? You need to have adequate protein repletion. So we have good functional foods that can assist people. I think about the digestive issues that are going on. So not only probiotics, but perhaps glutamine will help the epithelial lining of the GI tract. So I think about things like that. If patients really can't eat, maybe we should be giving them full spectrum amino acids, just so that they have the building blocks that they need, right? Nobody's going to, use that as their diet, but therapeutically, patients can quickly become depleted in essential nutrients.
Right, and some of these patients do have a loss of appetite.
Yes, well, fever does that. Yeah, fever does that. So, and what is...
Now, what's your perspective on fever?
Well, fever is a normal part of an immune response. And so in naturopathic medicine, we don't try to decrease a fever. We know that high fever is really only dangerous to the young brain, right, for seizure. But typically adults don't have anything dangerous happen to them. And so it's part of the body's solution to make the environment inhospitable to the organism. And so I don't have a problem with a person having a fever, but as soon as a person has a low-grade fever, we should be moving them in our mind into the category of active infection and being concerned about cytokine storms. We should be concerned about that. Right.
So one of the tricky things is there's a percentage of patients who don't have any symptoms at all and are outside spreading the disease.
Well, probably a lot of kids are in that category.
Yes.
Probably a lot of kids are getting it and sharing it with other children and with their adult caretakers. And
now, young kids are typically very vulnerable to the flu and don't do that well. Why do you think young kids do well with this virus?
Everyone has that question right now. We actually don't know the answer to it, but it might teach us something about the immune system, Maybe it's because they have an active thymus. I mean, who knows, right? Todd Lapine posited to use peptides, thymic peptides in these patients, which we also do in cancer patients to mobilize immunity. I just had a hip surgery and I took thymic peptides and I could see my blood cell counts change from doing that. I had much more robust immunity after using those. So but we don't know enough. I really think it's important not to experiment and conjecture, because we don't really know if that also might ramp up more inflammation. We don't know that, right? Because elevating white blood cells has the potential to increase inflammation and clotting risk as well. So again, I'm just very conservative. I do not experiment on people, even if it sounds like a good idea, because the border between low risk and high risk can change in a day in these patients, and we should not experiment on them. That's my comfort zone.
There's been some discussion about melatonin, and one of the reasons why older people not doing as well because they have lower levels of melatonin.
Well, I think the studies on melatonin are pretty good, and melatonin is widely used in cancer as well at high doses. So I think that melatonin has a couple of functions here. Of course, it's a super antioxidant. It can help quench some of the oxidative stress, but it also modulates immunity and impacts T cell function. And so because I have experience using melatonin in high doses, which most clinicians don't unless they're working with cancer patients, I'm comfortable giving 20 to 40 milligrams of zinc to patients. Some patients in the cancer setting get up to 180 milligrams of melatonin over a 24-hour period. And patients who are particularly sensitive to melatonin, the early sign is you get really vivid dreams. Now, melatonin is not a sedative. People think it's a sedative. It's a dark signal to the brain at 0.5 milligram. Okay, once you start getting into these super doses, you're not using it to modulate sleep cycle anymore. You're using it as a neurohormone and a neuroantioxidant and a signal to the immune system. And so that's very different. So I think also clinicians need to remember there are nutritional doses of nutraceuticals and botanicals and phytochemicals, and there are therapeutic doses. And we have to really understand the difference. So some clinicians are suggesting, for example, at early signs of viral exposure, that patients take up to 50 to 100,000 units of vitamin A for a few days. And although in all our educations, our textbooks tell us that that's liver toxic, I have never seen that in clinical practice. Never once have I ever seen that.
Yeah, so, the World Health Organization actually recommends for children to protect them from a vaccine to take 300,000 units.
Yes. That's done in developing countries when they give children, multiple vaccines at once. During the SARS epidemic, that was a coronavirus. During the SARS epidemic, the entire country of Canada instructed their population to utilize vitamin D, because we know vitamin D decreases vulnerability to viral respiratory infections. And again, a lot of physicians aren't well educated in the therapeutic use of vitamin D. And so you can give 50,000 units for 3 or 4 days and then drop down to 20,000 and 10,000 a day after that. But it's really the blood level of 25-OH vitamin D being close to 75 nanograms per milliliter where you get this change in immune response. So you can measure your patients. Vitamin D goes up very slowly. Even if you give high oral doses, it's only dangerous when it gets near 100 nanograms per milliliter, and then you start to change the compartment where calcium is found. But up to that, it's pretty safe. And so I think that using, with the general public, I feel safe saying you can take 10,000 a day.
Yeah, I think I've seen that as well. There's the occasional patient where you give them a modest dosage and it shoots up to 100, but it seems like 80% of them, it's really difficult to get that level up, especially if you're trying to get to a therapeutic range of, you mentioned 75, but somewhere it's 50 to 70, 60, it's really hard to get up to that range and keep it there. So, well,
in patients where you're having that experience, you're giving them fairly aggressive oral dosing, and you see the 25-OH vitamin D doesn't budge a lot.
I checked the 125.
You have to check the 125 because you want to see the rate of turnover. So we know that autoimmune patients and cancer patients utilize vitamin D at a much higher rate. And so we don't know that about these patients, but we could measure. We could find out.
Yeah, good. Okay. And let's see. I think that's about the thoughts that I had. Anything else you wanted to cover?
Well, I think that we should all really be thinking about how we are going to help these patients recover. So let's think about what happens for the patients who've had hospitalization or patients who've had aggressive bouts at home, right? And I'm seeing patients being sick for 2 to 3 weeks, beginning to end. And then at that sort of end where the virus and the sequela of the acute symptoms has dropped off, there are patients who are experiencing a lot of fatigue because their HPA axis has been on overdrive. So we need to help people with resilience, right? And think about our adaptogens.
Adrenal support.
Well, not only adrenal support, but the category of adaptogens, things like rhodiola and ashwagandha, also speak to the parasympathetic sympathetic balance. These patients have faced death, a lot of them, and so they've really been in extreme physiology, right? A lot of them have been alone and away from family and really sick and not having somebody there to downregulate them,
And it makes it even worse when they're in the intensive care, and not only don't they have their friends or family there, but the people caring for them are covered with masks, so they don't
right.
get to see their
that.
faces.
You don't get that, and if you're intubated, you can't speak for yourself either. So it's we have to think about. So there are people who have some large or small version of PTSD, and so that's vagal nerve, parasympathetic, balance. That's very important. I think all these people need their microbiome and GI tracts tended to. And then we have to look at, what subpopulation they were in. Did they go in to this with cardiovascular disease? Then are we concerned? Do we want them maybe to get an ejection fraction test when they come out to see if their heart muscle was damaged or not?
Sure.
We want to monitor if their hypertension is still well managed or now it's not well controlled. The diabetic, what has happened to them as a result of this? I think we don't know enough, but since we're looking for health, right? We're looking for health, not marginalized good enough, which is kind of the standard of care in medicine today. But if we really want to get these people back to robust health, that's one category of things we need to do. And then we need to also think about repairing damage. And so how do we make the heart muscle more efficient? How do we protect the kidneys and the lungs? And so, for example, in cancer, these organs are also damaged by the inflammatory nature of cancer, but also the pro-oxidative therapies they receive damage all these organs as well. And so we use milk thistle a lot for these patients. And so I think we need to, I don't have all the answers yet because I don't have enough experience with a large enough population of these survivors. But these are the things I'm thinking about. Certainly acupuncture is a restorative therapy that also helps you regulate, right? Helps you regulate again. So we need to sort of think about hormesis and all of the self-regulating functions that are disrupted by trauma, really, right? By emotional and physical trauma that these patients have gone through. And
also the trauma the healthcare workers are going through having to care for these very sick patients.
Yeah, I'm thinking about also putting together some ideas for caring for the caregivers because we have a whole traumatized, highly stressed population of heroes and heroines on the front lines. And I think there's a fair amount of anxiety, whatever end you're on, the patient end or the caregiver or the am I going to get it end. So we need to help our patients have better coping skills also.
Great. Awesome. Well, thank you so much for spending some time with us, Dr. Chilkov.
You're welcome.
How can people get a hold of you and find out about your programs and seeing you if they want to?
My clinic website is just my name, nalinichilkov.com, NALINICHILKOV. And my professional training for primary care frontline clinicians who want to care for the health of cancer patients and survivors is AIIORE.com. And if you opt in to my list on that site, you'll get a series of videos in which, very short videos, in which I talk about how we can begin to make a difference in the lives of these patients in primary care settings.
Awesome. Thank you so much.
Thank you.